So we thought once we got comfortable with the vest and the technology, we took it to the ward, and we did a trial we called the Best Discharge trial. And what you can see here, this is a single center randomized trial, about 110 patients. And these patients came with a decompensated heart failure. We have about 125 admissions per month at our hospital for heart failure. So we were able to enroll pretty quickly. We did this over about a 6-month period. The patients got screened, and then they got randomized. They got randomized to a treatment arm or a control arm. And then they were allowed to be taken care of. Now, they're either on the hospice service, they were general cardiology service, or they were on the teaching service, either family medicine or internal medicine teaching service. If they were on the heart failure service already, they were disqualified. So people got enrolled. There was 60 patients in the treatment arm, 48 patients in the control arm. And then we broke them down within each group, dry or wet. So the doctors called, they said, listen, patient so-and-so is ready to go home. If they were in the control arm, they just went, we measured their REDS reading and we sent them home. It went to the cloud, it was blinded, nobody knew about it. In the treatment arm, the patient got measured and then the number came up on the screen and we were notified. If it was under 39, they got to go home. If it was over 39, they jumped up and down in their room and said, I'm going home anyway. And then the heart failure doctor had to walk into the room and tell them, wait a minute, you're not going home just yet. So if you look at that patient in the treatment arm, you see 60 patients were enrolled, and almost a third of them, 18 patients, had a REDS reading of greater than 39. So we called this treatment wet. On the control arm, you see it was sort of similar. There was, you can see, and there was also 17 patients out of 48. So about a third of the patients in the control arm were also wet, and those were discharged as planned. For the intervention wet arm, what happened? You got a heart failure consult. Heart failure physician came, saw the patient, and then we took over therapy for that patient's heart failure. If you see what we had, then what we did. So here's sort of our primary endpoint was to look at the level of congestion remaining in patients prior to discharge. So these were patients who a doctor saw them and said, you are ready to go home today. And what you see, so if you look at all comers, 32% of the patients had a REDS reading that was greater than 39%. So these are patients, 1/3 of patients had a number that we would feel uncomfortable with seeing in the clinic and say this patient needs further intervention. 12% of patients had this sort of intermediate number between 35 and 39, which was mildly congested, and 56% were adequately decongested. So you have 44% of the patients that we measured their lung water before they were leaving the hospital who were thought ready to go home and still had elevated lung water. So we think there's a big opportunity here.